Okay, hello and welcome to this week's COVID-19 media briefing. It's Friday the 4th of June. I'm Steve Thorne and I work in the comms team at Nottingham City Council, and I'm here today with Abby Jakeman from Notts County Council's comms team. On our panel today, we have David Johns, Interim Director of Public Health at Nottingham City, Jonathan Gribbin, Director of Public Health for Notts County Council, and Amanda Sullivan, who is the Accountable Officer for Nottingham and Nottinghamshire NHS Clinical Commissioning Group. So the usual format applies today. We'll begin with opening statements from our panellists. Then we'll open the floor to questions. And as always, it's one question and one follow-up question. Please could I ask everyone to remain on mute with their cameras off until it's your turn to ask a question. And then raise your hands and I'll come to each of you in turn once the panellists have made their opening statements. So if everyone's happy, I'll hand over first to David Johns from Nottingham City.
Thank you, Steve. So in Nottingham City, in the 7 days up to the 29th of May, we see 78 cases. So this is an increase on the previous week and takes our rate to around 23 per 100,000 population. Now, across England, we've also seen the rates rise. The England average now sits at just over 30 per 100,000 at 32.4 per 100,000, a nearly 40% increase on the previous 7-day window, and this is expected to rise further. In Nottingham, based on the cases being reported to us, we also expect our rates to continue to rise going into next week. It's too early to predict if in Nottingham this increase will level off or if it's the beginning of a more sustained increase as we've seen in other areas. Leave that around 85% of the cases in Nottingham City are now likely to be the Delta variant first discovered in India. The Delta variant was first made a variant of concern due to its ability to pass from person to person more easily. The latest technical briefing from Public Health England, though, also highlights that there is a limited but growing evidence from England and Scotland of an increased risk of hospitalisation from the Delta variant compared with the Alpha variant that was first discovered in Kent. On a more positive note, the report from Public Health England also suggests that full vaccination, having a full 2 doses, is still having an impact, particularly on hospitalisations. The Delta variant, as I've mentioned, is dominant in Nottingham City. That isn't likely to change. Collectively, though, we do have the power to influence what happens next in Nottingham, including how fast the virus spreads and the impact it has on the NHS. So if you have symptoms, don't go to your GP, but instead go straight to one of our PCR test sites, or order and book a delivery of a PCR test online. And you also need to isolate with your family and household contacts to limit their onward infections and protect work colleagues, members of your local community. And given that we're all going out more and come into contact with more people, it's really important that we also ensure we use the free lateral flow tests on a regular basis so that we can ensure that we don't inadvertently infect others and turn one positive result into 3 or 4 positive results. While talking about asymptomatic testing, and given we are seeing more cases amongst our school-aged children than we have previously, I wanted to ask that school children and their families take a rapid COVID test on Sunday night or the night before they return to school. It's this sort of action and collective effort that can help us minimise the spread of COVID in schools, and particularly when pupils return from half-term. And vaccination, the message here is a simple one. Now is the time to get vaccinated. I want to thank everyone who has been vaccinated for doing so, be it to protect yourself, family, your child's school, or because you want to help keep Nottingham open. And there's also a huge thank you to NHS colleagues for the variety of offers that they've made available for people to go and get vaccinated. But my message to people who have, for whatever reason, not taken up the offer, it isn't too late. NHS colleagues have a vaccine ready for you, be it the vaccination bus at a community pop-up clinic or in one of the main testing sites, main vaccination sites. NHS colleagues are here for you, ready to vaccinate you, regardless of whether you've just become eligible and booked or if you've changed your mind, and if you're over 40 and are just dropping in. So rates are beginning to increase. I can't say if that trend is set to continue, but what we do know is that the variant circulating in Nottingham has that potential to continue to push rates up. And importantly, though, we are still in that window of opportunity where we can collectively have that ability to influence what happens next in Nottingham City.
Thank you, David. I'll pass over now to Jonathan Gribben from Nottinghamshire County.
Good morning, everyone. I'll say a little bit about the rates in Nottinghamshire County. I'll make a couple of points to note, and then there are really two messages that I'd like to emphasise this morning. If we look at numbers of new cases across Nottinghamshire County over the last week or so, we've seen 128 cases, and that is equivalent to a rate across the county of 15.5 per 100,000. That's actually slightly lower than it was a week ago. Of course, within the county, as ever, we see some variation. Newark and Sherwood is the district with the highest rate at the moment of 28.6 per 100,000, followed by Mansfield at around 20 per 100,000. And the other districts and boroughs in the county are in the teens or close to the teens. So all of that is quite a promising picture for Nottinghamshire County. But of course, we know that we don't have to look too far away to find areas of the country where rates are rising. And of course, the rate in England overall has gone up over the last week or so. And in the East Midlands, many parts of East Midlands, it's higher than we are. And we know from our experience over recent months that in Nottinghamshire County, we can't insulate ourselves for very long from what is happening elsewhere. I think there are two things that I really want to note this morning. The first is that the best evidence we have at the moment is that the Delta variant is associated more closely with hospitalizations than the previous dominant variant. So I think that's probably a pretty good indication at this stage that it's associated with more severe disease. What we also need to note in Nottinghamshire is that we're seeing the Delta variant now spreading across the county. Initially, it was most focused in the city and in the suburbs around the city, but we see that spreading more widely across the county. So bearing those two things in mind, there's really, we need to consider what we can be doing then in Nottinghamshire to guard against a resurgence which would set back what we're all wanting, which would disrupt again our schools and local economy and even threaten our local NHS. So right now, it's important that we remember that it's never too late to slow the spread of the virus. And it's never too late to do that to save lives. Never too late to slow the spread, to slow lives. Firstly, it's not too late right now to take up the offer of a vaccine. It's provided a lifeline to hundreds of thousands of people within Nottinghamshire, and hundreds of thousands have taken up the offer. And we want to make sure that it doesn't become too late for you. If you've received the offer of a vaccine, I urge you to catch hold of that lifeline while it's available to you. So I'm asking particularly people aged 40 to 49 to take advantage of that. Take up the offer quickly, get the vaccine before COVID gets you. Secondly, I'm urging families with young people of secondary school age who've been enjoying half term over this last week to make sure that you get your regular lateral flow tests taken this weekend before the return to school next week. I'm conscious that many of you have been massively impacted by COVID-19 over the last year, and many of you have already made many sacrifices. But once again, it's never too late for each of us to play our part in slowing the spread in order to save lives. So I'm asking you once again for your help with that. Please make sure that you get your lateral flow test this weekend before your return to school. Thank you.
Thank you, Jonathan. And finally, we'll hand over to Amanda from the NHS.
Thank you. Morning. So our hospitals and our GP services are very busy as more people are coming forward to seek healthcare for things other than coronavirus. Fortunately, the numbers of people in hospital with coronavirus and the numbers of deaths from coronavirus remains low. But we do know from previous waves that that position can change really very quickly. And we also know that the Delta variant is now dominant, it is easier to catch, and it's more likely to require a hospital stay. So we are in that race against time to protect as many people as we can against the virus. Our vaccine programme is still in full swing. And although 50% of adults across the country have had 2 doses now and so are fully vaccinated, we do still have significant numbers of people who are yet to receive their first dose or who are not fully vaccinated with both doses. If you're over 30, a carer, or are clinically vulnerable, there is a vaccine waiting for you. I'm actually having my second dose of AstraZeneca tomorrow, and I'm going to be very pleased to have that because we know that with the Delta variant, the level of protection just from the first dose is less than with the previous variants that we saw. So the second dose does give a much better rate of protection. I also just wanted to reiterate that if you are over 40, you can walk into any of our vaccination main sites and have your vaccine. And there are plenty of appointments over the next few days, over the next few weeks available for you. So please do come forward. If you've been invited previously and you haven't taken up the offer, take it up now. If you have recently been invited, also take up your offer. Thank you.
Thank you, Amanda. I'll open the floor to questions. Do we have any questions from the media for our panelists? First hand up is Hugh Caswell. If you could, I know we've done this for a while, but it would still be helpful if you could identify yourself and where you're from, if that's okay.
Sure, yeah, Hugh Caswell from BBC Radio Nottingham. I had my first jab this week, and it was the service was absolutely fantastic, I have to say. It was great, so thank you to everyone involved in that. Some of the, well, this is to David and Jonathan, I suppose. Some of the recent figures for case rates have shown the whole city and county as being below the England average, which it feels to me like is something we've not been able to say all that often throughout the pandemic. But David, I think you said you expect rates to continue to rise, and Jonathan, you talked about us being unable to insulate ourselves for too long. So do you both view this as where we are right now as potentially being the start of a third wave?
Thank you, Hugh. Who would like to go first?
Do you want to go first on that one, David?
Yeah, sure. So for me, what we're seeing at the moment is that the rates in England have been increasing. We've managed to maintain a stable rates over the last few weeks, but what we've now seen is sort of that uptick in our number of cases that we're getting, and that is set to continue. As it is set to continue across many parts of England. The extent to which that continues and how quickly it escalates and increases in terms of the number of cases is a little bit of an unknown. What we do know is that the variant that is dominant in Nottingham City has that ability to pass from person to person much more readily than previous variants that we have. So there is that potential for the number of cases to increase quite quickly. However, we're at the cusp at the moment, and our understanding of where we will head in the next few weeks is a bit unknown. But I think the important thing is that it's also something that is changeable. It's something that we can influence and that we can all play a role in to change the trajectory over the next few weeks of how many cases we see in Nottingham City. by ensuring we get tested when we have symptoms and isolate so that we reduce our risk of infecting other people. So also making sure that we identify if we have no symptoms, but we might still be have that potential to infect other people, and therefore taking those rapid tests, especially since now we are meeting up with more and more people, so there's that more risk of being able to pass on the virus to others. And getting vaccinated. We've heard that the importance of having that second vaccination. So, you know, it's been fantastic weather, but don't put off that appointment, that second vaccination appointment. Now is the time to have it. Now is the time to protect yourself and to protect the local system. So, you know, what is to come is a sort of unknown potentially at this stage, but there is that risk that due to the variant that we have now as a dominant variant and are living with in Nottingham City, there is that potential for rates to increase over the next few weeks.
I wonder if I might add a word or two, partly to echo and underline what David said already. Hugh, I know you follow the rates and the numbers very closely, and you're absolutely right what you observed about the numbers. Of course, the average in England at the moment, which is increasing, is quite heavily skewed by some areas where the rates are very high. What we have in Nottinghamshire County at the moment are rates that are very similar to much of the rest of the country. And it is true that we don't insulate ourselves for very long. We also know from the modelling which SAGE have produced that we should expect a resurgence on a national scale sooner or later. What is still unclear is about the exact timing of that, and quite what the shape of that curve will look like. We're all familiar now with seeing on our TV screens these epidemic curves, and sometimes they can be very short and very sharp, other times they can be much flatter. But I think we need to remember that if we're picturing that curve, whatever shape it is, in that area under that curve, sadly, there are people who end up in hospital as a result of complications. And very sadly, some of those will pass away because of their complications. If we look back in time, we do know, of course, that many of those people were older or had other underlying health conditions. Nevertheless, there are also younger people there as well who end up hospitalized and who even pass away as a result of those complications. So that is one of the reasons why today we're giving such strong and fresh emphasis to the need for everyone who receives an offer of a vaccination to quickly come forward for that, and to make sure if you're receiving the lifeline of an AstraZeneca dose, that you also take advantage of the second dose as well, because that will maximise the protection that each of us can get against coronavirus. Thanks.
Thank you, Jonathan. Hugh, did you have a follow-up question?
Yes, please. One for Amanda. Given what we've heard about the increased risk of hospitalisation from the Delta variant and the fact that it is dominant in Nottingham, is the local NHS expecting a rise in admissions in incoming weeks? And can you give any detail at all about the work that's going on to prepare for that possibility?
Yes, thank you. So as Jonathan said, there are lots of variables and lots of things that can happen to change that picture. So there's not an inevitability, but what I would say is that the NHS is prepared should it happen. And we obviously have been through previous waves and have learnt a lot about that. So we are very much hoping that we're able to protect the services that are currently really needed in hospitals at the moment, and the build up that we've brought back in of our planned procedures. We're hoping that if we to protect as much of that as possible, so people aren't waiting a long time for their operations. But also we have got very good plans in place should we have another significant third wave.
Thank you, Amanda. Thanks, Hugh.
Cheers, thank you.
The next hand I can see is Alex Hulse.
Hi, yeah, Alex Hills from Capital FM and Global Radio. It's just a very a couple of questions if I can. Just firstly, I'll ask this one first, and then I'll come back to the next one if that's all right. Just firstly, obviously you're doing quite a lot to try and encourage people to have those second doses and maybe even the first doses. We've heard anecdotally of some centres, some vaccine centres ending up having to leave and go home early for the day and cancelling the sessions because people are not necessarily turning up for their doses, even though that they've been booked in. Is that a concern for you? And do you think then that will perhaps have an impact on figures of people being taken into hospital?
Yes, thank you. Yes, we have seen in the really excellent weather that we've had this week, we have seen an upturn in people not attending for their appointments, and that is a matter of concern for us because we want as many people as possible to have received their vaccine. It's really important because it's the single best thing you can do to protect yourself from the virus alongside social distancing. So it is a concern, and would really urge people to keep their appointments, make your appointments and keep your appointments.
Thank you, Amanda. Alex, did you have a second question?
Yeah, I did. I realise this might be some of the nuances might not necessarily 100% clarify with you guys, but we are aware of people who are coming back from countries on the amber list who are obviously having to isolate and also have tests, which are obviously done via private companies, and some of those people are actually not receiving any results. And then NHS Test and Trace are saying in that time, if you've then done your isolation period, you should then stay in for another 4 days to take it up to 14 days. Is that something that you've been made aware of, any of you guys, or is that news to you? I guess really there's a number of people certainly quite concerned that they're not getting some of the service that they've obviously been promised by buying some of these tests that are approved obviously by government and the Department of Health. I don't know if that's anything that you've heard of, or if there's any guidance that you might give to people. I mean, a lot of people are sort of saying, well, I've done my 10 days isolation, so why should I stay in any further if I've done my bit of the bargain, sort of thing.
Okay, thanks, Alex. So I guess just focusing on the need to isolate. So David or Jonathan?
Alex, thank you for your question. I have to confess that isn't something, the specifics around that isn't something that I'm aware of. I think all of us as residents and citizens will want to expect that we receive the service to which we're entitled if that's something that we've paid for. I would just want to add that I'm grateful for people coming back from those countries who are being diligent about complying with all of those arrangements. It's so important that we damp down and slow up the spread of coronavirus. And although it must be very unwelcome to some of those people returning, it's really important that they play their part as well. So I'm wanting to acknowledge that and to thank them today.
Thank you, Jonathan. Alex, David, did you want to add anything?
Nothing really to add. It's like Jonathan, the specifics of that particular situation isn't something that I've been made aware of. But similarly, I can appreciate the frustrations that people are having. But as Jonathan said, it's a big thank you for those people who are taking part in that in the testing and following the advice provided to them by Public Health England on their return from those amber countries.
Thank you, David, and thank you for the question, Alex. The next hand I can see is Anna Whittaker.
Hi, it's Anna Whittaker from the Nottingham Post. So my first question is surrounding travel and holidays, which obviously there's a lot of talk around at the moment, especially with Portugal being removed from the green list. What's your message to people in Nottingham and Nottinghamshire who are thinking about booking a holiday or who have a holiday booked, whether that be sooner or later in the summer, what would you say to them? I think there's a lot of confusion at the moment about whether things will be able to go ahead or not.
Thanks for the question, Anna. I know a lot of that is sort of set nationally and out of our hands, but Jonathan, David, I don't know whether you have any thoughts on that.
I can oh, go on, David.
No, you go, Jonathan, first. Go for it.
I hazard one or two comments, if I may, Anna. Thank you for the question. And yes, it's that those questions are in lots of people's minds at the moment, understandably, because after a long year and a difficult winter, there are lots of people who are looking forward to being able to get a break for themselves and their families in the coming weeks and months. In terms of the decisions which individuals must take about where they holiday, and that is very much a matter for individuals, and I think it would be unhelpful for me to prescribe in general about what people should plan or not plan, other than to say that we absolutely rely on everybody playing their part in stopping the spread. And that does mean that if people are travelling to locations which they may well be permitted to travel to, but on their return are required to undertake testing or quarantine arrangements of some sort, it's absolutely essential that people do follow through on that, and along with everyone else, play their full part in slowing up the spread of coronavirus. We want to make sure that if we are indeed hit in due course with a third wave, that we delay that as long as possible, and that we suppress it as far as possible. And all of these different steps on their own might seem like quite small contributions. Nevertheless, they're really important. So I want to thank again people who are making arrangements to ensure that they do comply fully, and to acknowledge the efforts that they're going to.
Thank you, Jonathan. Anna, did you have another question?
Yes, please. I just wanted to ask Jonathan and David what the R rates are for Nottingham and Nottinghamshire at the moment. I think, Jonathan, you might have mentioned it before, but if you wouldn't mind just reiterating those rates if possible.
So unless David has it to hand in front of him, I'm going to ask Anna if we can come back to you later on in the meeting. It is in an email which I regret I forgot to check out just before coming onto this call. So Steve, perhaps you could arrange for us to come back to that shortly.
Yeah, is that okay, Anna?
Yeah, of course. Thank you very much.
Are there any other hands? Sometimes a quirk of Teams means I can't always see everybody's hand. I know Owen Shipton, your hand was up for a while. I don't know if you still have a question for Notts TV.
No, mine was related to travel. So I think that's been covered already. Thank you.
Okay. Are there any other questions from the media here? There are any hands that I can't see? Okay, well, Anna, with the outstanding question around the R rate, we'll email that to you. And what I might do is I'll circulate to everyone the link from of this recording when it's on YouTube, and I'll include the R rates in that email as well. So you'll have that for Nottingham and Nottinghamshire, if that's okay. So if there's no more questions from the media, what I'll do is I'll just take an opportunity to pause and turn back to our panelists. I just want to check that we've covered everything that we want to get across today, or if there's any other closing statements that you'd like to make. Jonathan, is there anything else that you feel you want to cover here today? Thank you, Steve. So there is one other thing which I'd like to mention, because often I come onto the briefings on a Friday morning with an update, and then urging residents and citizens about how they can support us in that. And that, of course, remains the front line, really, for where we're all trying to deal with this virus. It's very much around our individual actions and the part that we each play. But of course, alongside that, there are other arrangements that we're making within the local authorities to sustain our delivery of the local outbreak control.
And I just wanted to let you know that in the background, we've been putting in place some of those plans for how we can sustain that over the coming months, through the coming winter, and into next calendar year and beyond. So we're doing that because the government set out in its contain framework that this is a responsibility of local authorities. And back in March, we refreshed and republished our local outbreak management plan for Nottinghamshire County. And alongside that, government has provided to us some ring-fenced funding to help us to do that. So over the coming months, I just want to confirm that we will continue to have in place a COVID response team, which will continue to undertake that daily surveillance and data analysis that we've been doing for the last year or more, that will continue to be in place to make a response to outbreaks as they arise, to continue to advise and support different settings on the infection control measures that they can put in place. We're also very clear about the need to continue to support local communities in taking up the offer of testing when people are asymptomatic, and also making sure, of course, that there continue to be really good arrangements in place to test people who are symptomatic. And alongside all of this, from time to time, we're also engaged in arrangements, for example, undertaking contact tracing by following up people on their doorstep, and of course all of the communications and engagement that goes on around all of this as well. So in county, we're establishing a team to sustain that over the coming months, and we're looking forward to making some of those plans available in the next week or so. And it's something which our elected members will be debating and looking at shortly in the Adult Social Care and Public Health Committee, which meets next on Monday, the 14th of June. So I just wanted to underline that as our part as a local authority, in terms of our ongoing efforts to make sure that everyone in Nottinghamshire County can live confidently and safely with coronavirus.
Thank you, Jonathan. David, are there any closing remarks you'd like to make?
Yeah, no, thank you. I think to build on sort of some of that, I think is, looking forward and thinking about how we can support citizens going forward is the sort of things that we do in public health on a regular basis. But what I just wanted to close on is just that re-emphasis of the here and now, and what we can do to make that difference in Nottingham City, be that getting tested when you have symptoms. So that involves not going to your GP or waiting permission to be tested, but just going to one of our symptomatic testing sites and getting yourself a PCR test. If we're going out and about, please do take part in that regular free asymptomatic testing program that's taking place, and make sure that we're making informed decisions about going out and meeting up with friends, knowing the risk of potential transmission. And then most importantly, taking up the offer of vaccination, and be that your first dose or your second dose. I think it's really important that as many people are taking up that offer of vaccination now, rather than waiting or putting it off. So I think those are the sort of key messages and take-home points for me.
Thank you, David. And finally, Amanda, is there anything else that you'd like to add before we sign off?
No, nothing further from me. Thank you.
Thank you. So it just reminds me to say thank you to David, Jonathan and Amanda, as always, for your time in being here today, and to Abby for supporting, and to the media colleagues, thank you for helping to keep the public informed about COVID-19. Abby and I are around if you have any further questions. I'll make sure that the R8 is circulated with the link to this briefing on YouTube. But otherwise, I wish you all a happy Friday and hope you all have a lovely weekend. Thank you.
Thank you.
Thank you.